Well, as states reinstate lockdown orders due to an increase in coronavirus cases, many are questioning whether the cure is becoming worse than the virus. I want to bring in former HHS Secretary Dr. Thomas Price to discuss the latest response to the outbreak. Hi, Dr. Price. Thanks for joining us today.
Greta. Oh, thank you. Thanks for having me.
Now, we've heard that phrase before about not letting the cure become worse than the virus. Business owners who have maybe, just reopened their doors are now facing closure again in several states across the country, especially in California. Is this a mistake for state leaders to be reimposing restrictions?
Well, I think what's important to appreciate is that this is a new infectious disease, and so we're watching it in real time. And so all the answers to all these questions really are unknown unless you look at the consequences of these decisions. Every decision, every action has a consequence. And as you mentioned, the consequence of closing things down is increase in unemployment. Certainly small businesses are suffering. You have a significant increase in drug and alcohol abuse. You've got increase in suicides. You've got increase in domestic violence, as well as delayed diagnosis and treatment of many diseases. So you have to look at the big picture. And when you look at the big picture, it doesn't make a whole lot of sense to close things down. Now, that doesn't mean that you don't focus on vulnerable populations and populations that are at the highest risk, and there are some, whether they're nursing homes or folks in confined areas. But that doesn't mean that you have to close schools or close businesses. We just have to be smart about what we're doing, and again, listen to the science.
If we put the rising cases in perspective, the jump does, of course, come with more testing, but it's also key to look at other factors, hospitalizations and deaths. Even with this pretty large increase in cases, how are those other figures looking?
Well, it depends on where you are in the nation, but by and large, the death rate has come down. Now, remember when all of this started, we didn't know what the death rate was going to be, what the mortality rate was going to be. And it was estimated that it would be 3%, 5%. Some folks even estimated 8 to 10%. Well, CDC has come out recently, and it looks like it's somewhere around 0.3 or 0.4%. Now, that's higher than the annual flu, but it's not nearly as high as many folks predicted. So it's important to appreciate that. And then when you look at the different sectors of our society, young individuals, those folks between the age of 5 and 17, their incidence of mortality or their incidence of rate of infection is only about 4 out of 100,000. And that's about 100 times less than folks over 65 years of age. So there are different aspects to this depending on where you're talking about in the population. And you've got to look at that and make decisions based upon that data, based upon that real information.
You mentioned the age group between the age of 5 and 17. That's been a big focus for the White House as they push for schools across the country to reopen. Earlier, you mentioned the other consequences of the shutdown for the pandemic. One of those would, of course, be the social impacts that children have faced as they've been out of school and not interacting with other kids. So how does the Trump administration and local governments, how do they open schools safely while considering all of those factors?
Well, again, it depends on where you are, but there's a clear path to being able to open schools and have in-person learning. Everybody wants kids to be in school and learning, but they want them to be able to do that safely. The good news is that if we listen to the science, we do the kinds of things that make it so that those kids can go to school safely, then we ought to be able to open schools. And those things are wearing of masks, social distancing, making certain that you're cleaning surfaces and washing hands, potentially having more classrooms outside at the beginning of the school year. Going through school with a cohort of individuals so that you have your own kind of bubble of folks that you're going through your classes with. That lessens the likelihood of being exposed more to the transmission of disease. But it's important to appreciate that if we listen to the science, if we look at the data, then we ought to be able to get society open and get society moving in a way that makes it so we don't have those adverse consequential problems of increasing disease, increasing drug abuse and alcohol abuse, increasing domestic violence, all the kinds of things that are consequences of the decisions that have been made to date.
All right, former HHS Secretary Dr. Tom Price joining us to discuss the coronavirus pandemic. Thanks so much for coming on the show today.
Thanks, Greta. Take care.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube. And call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.